Are you a pregnant woman who wants to know how to best take care of yourself during the season in your life? Many, if not all, pregnant women want to have a healthy pregnancy. In this video, we will talk about the tips for a healthy pregnancy. Let's get started. Stay hydrated. During pregnancy, you require more water. Hemorrhoids, excessive sweating, constipation, and urinary tract or bladder infections are common among pregnant women. However, drinking water keeps you hydrated and helps you avoid many of these common diseases. Premature or early labor can also occur if you don't drink enough water. During pregnancy, it's critical to drink enough fluids, especially water. Your blood supplies oxygen and essential nutrients to your baby through the placenta, while also transporting waste and carbon dioxide away, which means your blood volume increases by up to 50% to handle all this extra activity. The Institute of Medicine recommended that you drink around 10 glasses of water every day. Your fluid consumption includes water, juices, coffee, and tea. However, keep in mind that some beverages have more added sugars and empty calories than others. Avoid harmful substances. You and your baby are naturally protected against some of the most preventable health concerns if you avoid alcohol, tobacco, and other drugs during pregnancy. Tobacco, alcohol, and narcotics can all be hazardous to one's health. When a pregnant woman or nursing woman consumes these chemicals, her baby is exposed to them as well, because all substances pass through the placenta and into the baby's circulation via the umbilical cord. Babies born to mothers who use drugs such as cocaine, heroin, or methamphetamine are more likely to be addicted and experience withdrawal symptoms. They may also have physical issues as well as behavioral or learning issues. Exercise within limits. Whether you're pregnant or not, physical activity is necessary to maintain your heart, bones, and brains healthy and strong. Being physically active is beneficial to your overall health since it can help you manage stress, lose weight, improve circulation, enhance your mood, and sleep better. Unless your doctor advises otherwise, you should engage in at least 2 hours and 30 minutes of moderate intensity aerobic activity each week. Consider moderate intensity low impact exercises such as walking, dancing, swimming, and bicycling. Avoid activities like soccer, kickboxing, rock climbing, skiing, or gymnastics where you can get hit in the stomach or fall. Take frequent rests, drink lots of water, keep your balance, avoid working out in high heat or humidity, and don't push yourself too hard. However, you should avoid high-impact aerobics and sports and activities that put you at danger of falling or injuring your abdomen. Contact sports, downhill skiing, scuba diving, and horseback riding are among them. Be extra careful when traveling. When you're pregnant, life doesn't come to a halt. It's certain that you'll have to travel during your pregnancy, and that's fine. Check with the airline before booking a journey to see how far along you can fly. Most airlines will allow you to fly until you're 36 weeks pregnant, but some have an earlier deadline. On a long journey, your feet may swell, so wear comfortable shoes and loose clothing and take a walk every hour or so. Blood clots during travel are much more likely during pregnancy. Compression stockings or leg exercises that you can do in your seat may be recommended by your doctor to lower your risk of a blood clot. Rest or relax. Make sure you get enough rest. You and your baby both require a healthy 7 to 8 hours of sleep each night. It's critical to get enough sleep while you're pregnant. You'll most likely be more tired than normal. And as your baby grows, finding a comfortable position to sleep in will become more difficult. To enhance blood flow, sleep on your left side. Listen to your body and rest when it tells you to. It can be difficult to find the proper posture to rest and unwind totally, especially later in pregnancy. But practice relaxation techniques like yoga, deep breathing, and meditation on a daily basis. If you need assistance, try to avoid stressful circumstances and rely on others. Get comfortable wardrobe. The focus of your pregnant outfit should be on comfort. Fit problems such as swollen ankles, swollen feet, and arch and heel pain are common among pregnant women. While pregnant, some women experience increased dizziness or clumsiness. And the last thing you want is for your wardrobe to exacerbate these symptoms. Comfortable and supportive clothing and shoes are the way to go. Your back and hips will appreciate it. Maintain a healthy weight. Always ask your doctor to decide the appropriate amount of weight gain for you. Gaining weight should be gradual, with the majority of the gain occurring in the third trimester. During the first trimester, you should gain 2 to 4 pounds altogether, then 3 to 4 pounds per month for the second and third trimesters. What happens to all that extra weight? Approximately 6 to 8 pounds goes to the kid, 1.5 pounds goes to the placenta, 2 pounds to the amniotic fluid, 2 pounds for uterus expansion, 2 pounds for breast growth, 8 pounds for blood and bodily fluids, and 7 pounds for protein and fat in your body. Isn't it fascinating? Reduce your intake of foods containing added sugars and solid fats if you think you're gaining weight too quickly. If you're not gaining enough weight, increase your daily intake of each food type. Stay up to date on vaccinations. To protect yourself and your baby from pertussis, popularly known as whooping cough, pregnant women should get the Tdap vaccine at any time during their pregnancy, but ideally between 27 and 36 weeks. A vaccination is a medication that aids in the prevention of certain diseases. Vaccinations protect you and your baby from diseases and infections that can be fatal. It protects both you and your baby throughout pregnancy. Many women may be unaware that they are lacking in immunizations and are thus vulnerable to infections that could harm them or their unborn child. Pregnant women should see their doctors to determine which immunizations they may require and whether they should receive them during pregnancy or after the birth of their child. Visit your doctor for prenatal checkups. Early and frequent prenatal checkups allow your doctor to keep track of you and your baby's health. Pregnant women who do not receive regular prenatal care are more likely to have a kid with low birth weight or other issues. Consider group prenatal care if it is available. If your pregnancy is going well, you'll see your doctor monthly for the first 28 weeks, every 2 weeks from weeks 28 to 36, and then weekly from week 36 until delivery. Inquire about your prescriptions and don't make any changes until you've heard from your doctor. If you're bleeding or leaking fluid from your vaginal area, having sudden or severe swelling, severe or persistent headaches, a fever, are vomiting, feel dizzy, have thoughts of harming yourself or your baby after 28 weeks of pregnancy, or suspect your baby is moving less than normal, call your doctor right away. Before we proceed with number 1, please make sure to finish the video until the end as we have a bonus tip. Please like, share, and subscribe to our channel for more baby tips. Here we go with number 1. Make sure you're getting enough calories. Make sure you're receiving enough calories to keep your weight in check. For at least the last 6 months of pregnancy, most women require an additional 300 calories each day. This is not the time to decrease calories or go on a diet now that you're eating for 2 or more. In fact, you'll need an extra 300 calories per day, especially later in your pregnancy when your kid is growing rapidly. You'll need even more if you're very skinny, very active, and carrying multiples. If you're overweight, however, your doctor may urge you to cut back on extra calories. It's always vital to eat well, but it's extremely important when you're pregnant. As a result, make sure that your calories come from nutritional foods that will help your kid grow and develop. Lastly, the bonus tip. Take a prenatal vitamin. This vitamin should be taken every day to keep you and your baby healthy. Because you're manufacturing more iron, your body needs more. The Centers for Disease Control and Prevention, or CDC, recommends that all women of reproductive age, especially those who are expecting a pregnancy, take 400 micrograms or 0.4 milligrams of folic acid supplements every day. In addition to the folic acid found in diet, this can come through a multivitamin or folic acid supplement. Prenatal vitamins are supposed to be a supplement to your diet, not your sole supply of essential nutrients. That's it. I hope you find this video helpful. Anything you want us to tackle on our next videos? Please tell us in the comment section below. Thanks for watching!